Hello, this is Amy Gleason, and today I'm going to tell you about how CareSync solves the four main barriers to patient engagement. But first, let me show you around a little. So today I'm logged in as Lucy Carter. Lucy Carter is a mom, so here's Lucy's family, and these are all the people that she can help manage their health. Right now you can see her son Sean is in focus, and Sean is an asthmatic. On the right side of the screen, you can see all of the other people who help Lucy manage Sean's care. This is people like other family members, a school nurse, and even our CareSync Plus service. This activity area is kind of like a Facebook feed, but for your healthcare, so that all the other people who help care for Sean can see a history of what's been happening. And here in the middle, you can see this is the My Day area. So this is showing what Sean needs to do today, things from taking medications to an appointment to tasks that need to happen today. So CareSync is a free application to get on the web or in the iPhone or Android store. So you can do it yourself and enter your own information, track your own health history. But we believe that it's a lot easier when you have a partner in your healthcare. So CareSync Plus is our service where we partner with you to manage your health. So these are the three main steps that you go through when you sign up for CareSync Plus. The first one is to request your records. The second one is to add family and caregivers. And the third one is to manage visits. So I'm going to click on Request Records, and from here you can add in a provider. So you can search for a provider, and all of that information is already in here for you. So once you search for a provider, all of that information is here for you, so you don't have to know any information about that doctor. And then once you save, you get a green Request Records button. It's that easy to get started. You just click on how far you'd like to go back in your request, the type of information you'd like to receive, and then you get the Hipaa authorization form. At this time, I sign my form as Lucy Carter, the mom of Sean. I say I'm the parent, and then I say Next. Now that quickly, I've requested the records, and the CareSync Plus representatives go to work to start getting Sean's information. So the first thing that they do is they get all of the documents in. Now these come in a variety of ways, and we take them any way that we can get them. So sometimes that's by mail on paper, other times that's by fax. Sometimes we get electronic files in a standardized format, like a CCD format, or we get them on CDs. Pretty much any way we can get them. So the first thing we do is give access to the documents. So for example, you can start to click on the office visit and you can see information about that visit. So this is great because it's usually the first time that people have really seen their medical record. It's kind of a difficult process to go and get those. So that's our first barrier to patient engagement is access. So this just solves the basic access problem, and now patients can read their information and they can see their errors that they're there. So about a third of our patients have found a medical error just by getting access to their information. So this is great, and it gives patients some leg up on what they've had before, but it really doesn't take it to a meaningful level that they can share and collaborate on. So the next barrier we think is meaningful information. So we take all this data, and you can see here on the health summary dashboard that we've brought that information up a level. So you can see a summary of what's going on, including recent updates that's happened in each category. And then you can click on each area and see things like health conditions. So our health assistants get all of your information from your medical records, and then we summarize it into meaningful health data. So in this case, we're in health conditions. So they enter in all of your past health conditions as well as all of your current ones, and we start to link all this data together and make it make sense. So here for asthma, for example, you can see that we're tying it to the medications, to the provider, and putting in notes that are relevant for that condition. So we also use medical databases as we do this. So if I type in diabetes, for example, you can see that there's a whole database of things here. And why this is important is because if a patient were to enter in high blood pressure, for example, and the doctor had written hypertension in the medical record, our databases are smart enough to know that those are the same thing. So it's really important we now get all this data into standard terminology, and now it's all shareable that you can use this to share with your doctor. And that's great. Now the next thing we do is we actually create a medical timeline for you. So we take all of that history that we get and we create a medical timeline. So you can see there's just a summary of what happens at each visit. So you can always click on the more and see a little additional information. So basically it's a summary of the visit as well as any notes and tasks for the visit, related health conditions, medications, and the actual files that were associated with it. So in a quick view you can see everything that happened at that visit. And this data is also filterable, so you can really look into it and do a deeper dive. So here you can filter by date, by provider, by different appointment types, health conditions, and even medications. So this allows you to come in and really filter out what you'd like to see. So I can pick, these years, for example, or maybe I just want to see a certain condition. And then I can click on this view and share, which takes me to my third barrier to patient engagement, which is collaboration. So this gives you a shareable document that has your basic information like allergies and providers, including the specialty and the phone number, your health conditions, medications, emergency contacts, as well as these visit summaries. So a great way to use this is the day before a visit, this document can go over to your doctor along with any concerns you have for the visit. It gives them all of your current information, as well as anything that's happened just since the last time you saw them. So it gets them caught up before you even get there, and they can get right down to helping you solve your health condition and working with you on having better health. So we always send to the lowest common denominator at a minimum, so you can always fax. We like to say that the fax machine is America's favorite medical device. So everybody has a fax machine. And then we can also send it electronically if that provider can take that in a standardized format. So now we've given you a way to collaborate with providers, and then we've also given you a way through similar to Facebook permissions where you can say whether somebody can access your pictures or your statuses. In CareSync, you can decide whether they can see your appointments or your medications or your documents. And so all of your family members and caregivers can also have access to this information if you give them permission to. And this also lets them get notifications like these little red circles are telling you, so you can get notifications on things that are going on for them. So that brings me to the My Day screen. So as we talked about in the beginning, this is your task list and your kind of go-to record for the day. But another part that's really important of what we do is we get all this information from all of your doctors, and we often find that they have different information. So then we take all of that and we actually find out what the truth is. So we ask the patient, what are you taking? And we get their schedules in here so that they and their caregivers can get reminders about the medication. Or maybe you just want to get a reminder if they didn't take their medication. So this is great. So if you live in a different state, maybe from a parent, and you want to get an alert if your mom doesn't take her medication, or if you're a parent of a teenager like I am, then you want to get an alert for your teenager not taking their med, you can do that as well. So another area of collaboration is as we do tasks, you can get comments from your family and caregivers on your tasks. So in this case, Sean needed to improve his diet a little and work on that, and so now his mom is giving him encouragement. Other ways that this has worked is patients that are getting chemotherapy or radiation or any kind of health thing they're going through, their caregivers can cheer them on and kind of help them through that process. So the collaboration is important. And then the last piece of collaboration is before a visit, you can come in and enter in any notes or things that you want to talk about at that visit so that you can send that over to the doctor ahead of time and use it for your notes as you go through the visit. So that brings me to the last barrier, which is convenience. So the first thing for convenience is we actually get all your medical records. That's actually a big area. But the next one is we let you request appointments. So you can come in and enter in what you need an appointment for, and then we make that visit for you. We also handle cancellations and rescheduling so that it really takes the burden off of you, and all you have to do is show up for the visit. Now the next part of convenience is actually on the mobile device. So now I'm going to flip over and show you what this looks like on a mobile device. Today I'm showing you on my iPad mini, but you can also use this from your iPhone or Android device. So first of all, I want to show you the My Day concept. So right from here on the mobile device, you can get push notifications that alert you that it's time to take your medication. And then you can just come in and document whether you took that medication on time or late, or if you missed it, you can pick the reason that you missed it as well. So maybe I ran out of that medication. So you can come in and document all of that information. You can also add any as-needed meds like Advil or Tums or pain medication. So it's really great to track how often you're using those, and you can use that also to tell your story. I also have quick access to my appointment from here. So here's my notes that I need to review before the visit. And then I can even come in and do things like voice record. So this is one of our most popular features. We've had over 80% of our members tell them that voice recording and our follow-up tasks that our CareSync Plus service gives them have helped them to remember some information that they would have otherwise forgotten from the visit. So I can just touch on that microphone icon, record what the provider is telling me from the plan and any discussion that we have. And then not only can I listen to that when we get home and any time in the future, but so can any other family members who are helping with the care. So this is really great for if you have a relative that lives out of town, maybe your parents live in another state. You can have them voice record it, and then you can hear the doctor's plan yourself and help them manage their visit. Or it's also great for parents who maybe one parent can come to the visit but the other one can't. And this way they can both hear that information and they can listen to it in their own space when they're more comfortable and can concentrate. So that's the biggest items here. I'll just quickly show you also that all of that same information that you had on the web is available right here from the mobile device, including that health summary that you saw, as well as the medical timeline is here, and you can filter that as well. So one of the great ideas is you can see there's always a share button in the upper right corner. So imagine that you're sitting on an exam table or you're in the emergency room and you need to share some information because they don't have it. You can send this straight over to their fax machine or electronically if they can take it. And then they have that information from anywhere in the world. You can do this. So that's really a great thing to be able to have this information at any time that you need it. So I'll wrap up the demo at this point, and I'd like you to check us out at caresync.com or in the Apple and Android store. Thank you. Have a great day.